Imagine going to the doctors and feeling like you're literally about to pass out. You're feeling so exhausted and fatigued. As soon as you get there, you get in and you wait patiently until the front desk calls you. You wait and wait until you hear your name and hope your name's next on the list. As soon as you hear your name, you run to the front desk and are greeted by your doctor, and he takes you into a more private setting. You sit down, and he does a protocol checkup, checks your breathing, your heart rate, and your temperature. He eventually asks you some few protocol questions and diagnoses you with just an everyday cold. He then prescribes you with some over-the-counter medicine where he believes will remedy your sickness. You are in and out in less than 10 minutes, and after taking the medicine, you still feel sick. This is a growing problem in our healthcare system today. Doctors do not take the time needed to properly examine and evaluate every single patient. This may be because they don't have the time to, or quite frankly, they don't care enough because honestly they're being paid by the volume and rather the value they give to each and every patient. Therefore, we will focus on primary and secondary preventions because 20% of people in America with symptoms of a disease or the disease itself take up 80% of the budget. That's according to the Commonwealth Fund in 2013. To help alleviate and resolve this problem, my proposition is to work diligently towards a system that differs from how doctors are being paid and rewarded now. Currently, the payment system is based on a fee-for-service system, which is a healthcare system that's around 15 years old. We need to move away from the generic approach about how many visits you could generate and how many tests you can order to an approach where it's more effective. Rather, we must use a pay-for-performance system, which not only improves quality, but also improves efficiency. What is a pay-for-performance system, you might ask? Well, a pay-for-performance system is a value-based payment that is used by purchasers to promote quality and value of healthcare services. The goal of the value-based programs is to transition from a pure volume-based payment system, such as a fee-for-service system, to one that is tied more directly to successful outcomes. The way a pay-for-performance system works is there's a base salary with a set amount of money given to a health professional no matter how much they make and how much the outcomes that they are given. The goal for the pay-for-performance system has three main goals. Motivates the employees to perform to maximum potential, gives the employee a reason to want to stay with the organization, and lastly, it attracts professionals to join. These goals can be very beneficial because when employees are given their best effort at each and every patient, they will give each and every patient a proper diagnosis, which in turn means that they can spot and detect early indicators or signs of certain diseases. It means that treatments will be being performed a lot quicker. Less patients are going to have a disease in them that will continue to evolve and grow, which will become harder to treat, ultimately lowering the total cost of the healthcare system in the United States. The United States currently spends 80% of its primary healthcare funding on only about 20% of the population. Within the 20% of the population, it includes individuals who have early symptoms of a disease and or the fully developed disease itself. It is definitely much more difficult to treat disease when it is refined and fully evolved. This can include, but is not limited to, diseases such as cancer, heart disease, tuberculosis, and many more. If we were able to get these indicators sooner, it means that we are able to start combating these diseases right away when they are not as strong and are vulnerable. When doctors and health professionals have more time and luxury to spend on each individual because they want the incentive, they will be more likely to thoroughly examine each patient. 44,000 to 98,000 Americans die each year because of medical errors according to the healthcare delivery in the United States. What's so upsetting about the situation is that most of these cases were preventable. Not only that, but we will always be able to focus on asking questions which may pertain to key indicators of something much more serious, such as an acute or chronic disease. It is quite simple. We can spot a disease quicker, we can respond quicker, which means that we can prevent a disease from ever maturing to its most threatening form. So instead of focusing our funds on only about 20% of people with symptoms or the disease already, we should aim our research towards a value-based payment system because not only does it take the form of a primary and a secondary prevention, it also plays a key role in motivating health professionals to do their job efficiently and to the best of their abilities. I strongly believe that this is a major concern in our healthcare system today. This payment system will increase competitiveness among health physicians, increase productivity, and ultimately lower the cost of healthcare overall in our country. Since we spend the most per capita compared to a lot of the modernized countries around the world, doing this will help our budget and lower that per capita rate. People are continuing to get sick and we're just passing them by as if they're all just numbers. When we start looking at everyone as an equal, then we will see change. Moving towards a pay-for-performance system will not only improve quality of life and healthcare of the citizens, but keep doctors striving to be their best. Thank you.